So I'm going to call the meeting to order at 5:04. We currently have 4 members in attendance. Do not have a quorum at this time, but we're going to go ahead and do a call to order and do a roll call and begin with some discussion of items, and then should those another member be in attendance, we'll move forward with motions to vote on items that are on our agenda to be voted on. So Amy, I'm going to turn things over to you.
Dr. Jones.
Here.
David Thief.
Here.
Kathy Manuel. Dr. Sander. Dr. Sherman.
Here.
Beth Benich-Sternot. Dr. Peterson.
Here.
Dr. Weissack. Dr. Goodley.
Thank you, Amy. On the approval of the agenda, I would like to ask, because we do have a member that will have to leave shortly, I'd like to move agenda item H1 and agenda item I2 to the top of the agenda. Hearing if there are any concerns with that. Any issues?
Just do it.
Okay, we're going to go ahead and move forward with that. We will table currently the approval of the minutes. So the first item, we have Sarah from Environmental Health here. The discussion and approval of the updated retail food program ordinance and enforcement policy. These are items 16 to 43 in the packet.
We had 2 separate documents, ordinances, that covered the same thing, and they were confusing in order for my restaurant operators and if we had any kind of enforcement to combine the 2. So I took the 2 the enforcement policy and the retail food code, and combined them and streamlined them. I also got input from operators that it was confusing to follow which part, so I combined them together. There were definitions missing that I added, and sections 7 and 9 I streamlined. Those are more of the enforcement proceedings. And then there were some recommendations for references in from the Assistant State's Attorney's Office due to recent legal issues that have occurred in the district. So those were also added in there.
Okay.
Questions for Sarah?
Yeah, so this has not been accepted by the county at this point, right?
That's correct. The district
We have
passed it
been
in
rejected
December.
on this approval.
We've had 2 separate ordinances that have already been approved. These were just combined into one.
Okay, they were approved at the county level?
Oh, absolutely. They've been
Okay.
in existence with the new food code, and they were all.
What was it that they were rejecting based on the inspections? Was it the placard?
It was the placards.
That was
which
it.
is
Oh.
which is intentionally still left blank in this. So if that ever does get revisited, we can add that section to mirror the ones for the district. But that is still left blank in this one,
Okay.
which is under section,
10.
yes.
Okay. All right, so I had, some of my questions were answered as I read further along, and it just was for me was in some cases, a question of organization. The one substantive thing, and again, the numbering on the ordinance is not going to be the numbering in the ordinance that was published. The numbering is just in our packet. Page 23, the term 12/1 to 11/30 is old news, isn't it?
The what? I'm sorry.
Is the term of the approval? Aren't we now on a calendar year, fiscal year for the department?
3-2.
From like December 1st to November 30th.
Yeah,
Like
that's the way it used to be. I think it's changed now. I think it's changed from the calendar year to the calendar year.
Yeah, I think it's changed from the physical year to the calendar year
For our budget.
yeah, for the budget.
Well, our billing Our billing cycle for the county is December 1st through November 30th.
Shouldn't it be changed to be consistent with the county department's fiscal year?
So if we do that, it would be a mismatch with the state. So we try to do as much as we can with a calendar year, but to do the billing accordingly. But if we change the billing cycle to the calendar year for our budgeting purposes, we won't match the state.
It won't match the state.
Because the state is based on the physical year.
Wow.
Well, that's interesting.
Because that has not changed. I mean,
Okay, that's not, no, but I just thought it was inconsistent with what I thought we had done with our fiscal year, which it was. On page 28, yeah, I think this is problematic. Electronic submissions do not require a signature. I think that's dangerous. There could be
I don't have-
there could be two-factor authentication, but I
I don't
think.
have numbers.
Yeah, it's 4 or 5. It says
right.
electronic report does not require a signature.
We don't require a signature on that.
Okay, that's what I'm saying. I think that's dangerous. I think that's a dangerous precedent.
We have nothing on our inspection program that allows us to do a signature.
So usually if there is an agreement that we are agreeing with other agency or memorandum of understanding, so we put those in Adobe so that we can do e-signature for both party, and then we save those on our file. But for these specific cases, I don't think there is need for signature. That's my
correct.
understanding.
Okay. Now, on page 41, there's a notice of report administration. You're supposed to respond within 48 hours. What happens if you're at the point that you're 4
So
o'clock on Friday?
what page is that?
At 41.
Mine don't have
Or
numbers,
40,
I just printed
yeah,
them.
41.
Can I sit here?
Yeah, I don't know.
Oh, it's 9.5, the last paragraph. A written report by the administrative hearing decision shall be furnished to the permit holder by the Board of Health within 48 hours.
Hmm? Yes.
Probably ought to be working something like 2 working days.
Oh, 2 business days. Yeah, by some time.
So what is the question again? Sorry.
Well, if you have a decision on a Friday, you're not going to get the report to the recipient on Sunday.
Yeah.
So the language would probably make more sense in terms of 2 working days.
Yeah.
2 working days.
Two business days.
2 business days, yeah.
Yeah.
I actually got one.
Yeah, that was good.
That's a good catch. That's
All right, well, there's not too much else. I mean, these, now, okay, so I was gonna ask who wrote this. Now I understand how this kind of came together.
Yeah.
I'm reading the thing, and I guess I'm making a mistake reading the thing, and all of a sudden I get to this language that talks about misdemeanors, Class B misdemeanors with significant penalties and for violation of the enforcement policy. And at that point in the reading, the enforcement policy is not defined. And this is an example of you shouldn't put together your Darth Vader, Luke Skywalker cruiser without reading the entire instruction set. Because the next page has got enforcement policy on it. I don't think that, and this is stylistic, but penalties should probably not precede the policy. description of the penalties ought to be after the policy. And that's what I got tripped up on. And it's a minor, it's a minor rearrangement, but I ended up wasting a lot of time on it, looking through the previous, I don't know how many pages, looking for enforcement policy, and it's not in the definitions. So, and then all of a sudden, here it is, it shows up, the next page or so.
Yeah, so moving section 11 to before 9(7), or before, like, section 11. Yeah, you're talking about like the enforcement.
Yeah.
Which sort of sets out like the definitions, yes.
And that's it.
Any other?
No, I
So
haven't.
you're,
You wanna clarify that?
you're asking for enforcement before penalties?
Yes. Description of enforcement should be before penalties for violating enforcement policy.
Yeah, because it's sort of defining what are the areas in which somebody could be penalized. Is that what?
Yeah, there's all of a sudden we're talking about misdemeanors when before we were talking about red placards, That's a major escalation. And so it didn't make any sense to me how all of a sudden, I didn't understand how all of a sudden we escalated to that level.
So order, right? Like when we're defining to put enforcement before,
Yeah, talk about
Penalty.
enforcement, which, really is a repeated violation, or sticking your thumb in their thumb in your eye. And then, at that point, then, after that's discussed, then the penalty. Delineation of the penalties. Class B misdemeanor, or death by hanging, I thought was in there. And there's, I think, just one other general point, and I don't have it, I haven't demarcated, because I thought about it on the way over. There's a sanction in there that if they violate repeatedly, that they can never apply again, and they can never apply for a license again. And that probably should be tempered.
should be what? Sorry.
Tempered somewhat, make it possible for even this group that you're in the middle of a court case with. I don't know if you're in the middle of a court case with it right now anymore. Still are? Yeah. To make it possible for them to open, because they're headed toward this. It sounds like they're headed toward that sanction. They're not opening up yet, so I mean.
Well, the revocation is something kind of different. Revocation is they're not able to pass inspections on an extended period of time.
And that's what you've got with this group you're currently in court with.
That's a little bit different of a case. That's not frequent failure as outlined in our enforcement policy.
But we're working with that individual to make sure that they open soon. So we're working with them.
Okay. Well, it seems to me that there ought to be a way for somebody, when they get a very big slap across the face, that they can then straighten up and fly right. So that would require some reworking of some language, I think. But it says they can never apply again, so that's like a death sentence or life imprisonment.
Well, I mean, in 30 years, I've only had 2 of those, and they have reapplied for permits, so.
And did they get them?
Yes.
So then the language isn't.
I mean, what we do is we work with them to come up with it, or they come through certain conditions in order to continue operating.
And that probably should be stated in some way, that there can be an appeal process with a showing of good faith or compliance.
And the restaurant that's going to point this out will be the competitor. It doesn't want them to get the
He
license.
doesn't want to get the license, yeah.
But you can also open up, if you put an or, like, can be like remediation or like completely can, in cases of really, really like negligent criminal kind of behavior that you're like, really, no.
Yeah.
But then gives you a little flexibility.
Yeah.
Does this ordinance have to be the same as the city?
I guess that's up to the Board of Health. I mean,
Is this largely what the city is?
yes, this is what they passed.
That makes sense.
Yeah, of course it does, yeah.
So usually whatever the city pass, so that's why we brought that up here, so that you guys can review and what's up. There's no much change.
It's all the minutia I have.
I mean, it does say in that section too, though, that the health authority may hold an administrative meeting to permanently revoke a permit.
That's correct.
And then if the permit holder is subject to revocation at that point, they can request to have an administrative meeting at 10 days to do that, otherwise they should be permanently banned at that point. So there is a may in there earlier on in the process, and so I think that gives that place for remediation too, or for the health authority to decide.
If you think that covers it.
So to go back and thank you, just to note for the record, we now have a full quorum with 2 additional members present. So to go back onto this, we have begun with H1 because we had a limited number of individuals and we were going to, David is going to have to leave at 6. So we began with H1 and reordered the agenda. Looking at those items, the one change we have made is the change of, on page 41, of 2 business days from the previous language of 48 hours. We have made no other additional changes to the language. And we do need to vote on this. This was the language that has currently been passed by the District Board of Health, and so it's come before us in that same form. I would assume that with that addendum and that change, then you'll go back to the district and they could reapprove that amended version.
So I guess that would be a motion on my part then, but
Correct.
we haven't
That would
actually
be the-
moved the ordinance.
We have not yet. I just wanted to make sure that, for those that join us a little bit later, to summarize where we are at right now.
I'll second the motion.
So Dr. Peterson has moved approval. Again, we're on H1, discussion and approval of the updated retail food program ordinance and enforcement policy, second by David. Any further discussion?
Do we have any recourse for if the flagrant violation of the rules of health and death?
I'm sorry, I
Yeah,
didn't.
we didn't hear it too much.
Is there any mention in the rules of what kind of penalty applies if the flagrant violation of the transmissible disease portion results in a death?
I mean, no, I mean, we deal with the illness part, but not a death.
It's called the legal system.
I would just say, if you want to like be more lenient and not make it a lifetime ban, it may be more prudent to say it won't be a lifetime ban unless your actions have resulted in the death of one person. You know what I mean?
Yeah, for the, you mean like for the restaurant owner? Like,
The argument about he didn't want like a death penalty for the business if they, you know, could never apply again. I think in that case, that level of severity of punitive action would be justified.
It may be hard to prove because like I was just imagining somebody gets sepsis and then they get intubated, but then they go into cardiac failure and they cardiac arrest, right? And let's just say at that point they pass away. Well, technically it was a cardiac arrest.
yeah, it was not,
And-
I would agree with you.
Yeah, even though it was really the sepsis, that was from like,
I think that's up to the coroner though, isn't it?
Expert
no, it
witness.
depends on whether Well, maybe in that case it would have to be medical exam. But either way, you would have to say the direct cause is like the cardiac arrest. So in the instance, right, if somebody had, and then they went through multiple things, even though that was the inciting event, technically it was the cardiac arrest or in this particular instance, right?
Another example is COVID, right? Like people,
That's very true.
yeah, people get COVID and, get infected with COVID and go to respiratory failure and died. Even though COVID was the infections, the cause of death on the death certificate is,
So it meant it to be cause or contributor in the cause.
yeah,
Yeah, but that's not, when you fill out those forms,
Yeah.
you can't actually, you
Yeah.
get to say the immediate cause of death.
They don't have lines for contributing?
No, because that could get really nebulous real quick.
Well, it gets nebulous anyway. I mean, research that's done on death certificates.
Interesting.
and usually it's us here who sign on death certificate.
Mhm.
If a cause of death is not clear, we won't sign it. We
Yeah.
would send it to the coroner to tell us what was the cause of death,
Mhm.
but we would not, if it's not clear, we would not sign it. So
Have
that's
there
part
ever
of,
been instances where you don't sign it and then the coroner says undetermined and then it's just kind of like, ooh, it's a mystery?
I haven't seen any of those.
That's interesting.
Yeah, I haven't seen any of
Because
those.
that would like, my eyebrow would be way up if, so nobody can agree, but nobody's gonna say what it is.
Yeah.
A lot of that would be solved if they allowed the old age.
Are they not allowed old ages? They don't allow old ages?
No, they don't.
Huh.
Multi-system failure.
Yeah. But it does get into an interesting point, right? Like, I was just thinking about, like, if people piece together the causative things, so where somebody else is suspecting had CJD, I still have my suspicions, but technically the test was negative, even though there's limitations. But I was just like, well, if they have this, they will die.
Right.
So then my concern is like, well, would we know that they died? And then would the person, if they went to some hospital, they're like, oh, well, this person they died for multiple reasons, don't think anything of it, and all the while they actually did have CJD, and all the people, involved may have been infected. Yeah, that was a little bit of stress.
I'm not inviting them to my party.
This is why I don't eat and not like it burnt. No.
Yeah, no, it was crazy too, because like I suspected they had a spinal procedure about 5-6 months before they presented, and they were just an interesting case, but don't know what
Yeah,
happened.
it just reminds me of the guy who got was it kidney transplant? Turned out they had herpes.
Oh, yeah, oh man.
Did you hear about that?
No.
Yeah, somebody died and they agreed to donate their organs. The person who received it got herpes because the person apparently had some kidneys.
Are there
That's-
any?
No.
So do I need to make a formal motion for that change on page 41?
So we've included that with
Amendment?
with the motion, and that's been seconded, we're in discussion.
That's part of
Are
that's
there
been
any-
accepted, it's
yeah.
front of it. Okay.
Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you very much, Sarah.
Thank you.
So the next in reorder of business is under old business, 2, discussion of the approved 25 to 35% fund balance being added to the County Board of Health bylaws. We had discussed this at the last meeting. This in fact was voted on several years ago by this body to establish a fund balance, looking at what we had gone through a couple of different episodes of an outbreak of measles in the community. We had an outbreak of mumps, and then we got hit by COVID. And so it was, at that point when we established, not really understanding what would be available for funds to offset losses to the community when we have to isolate individuals or when we have to have care care provided to individuals to assure that we don't have any further spread of disease processes in the county. And so it was recommended at that time to do this established 25 to 35%, and that was after a lot of review of what other counties and state departments were doing at the time. So that was voted on, and then when we got to discussing this at the meeting, last meeting, we talked about, well, it's not fully in our bylaws. And perhaps that does need to be incorporated within our bylaws, should those of us who've been here for a while, you know, leave this body, that there be an historical record of this within that is certainly our intention, and why we are leaning that way. I think it would also help, as we discussed at the last meeting, and please anyone chime in that was at the last meeting when we had this conversation, it would also be very clear to the county board that that is our intention as well, by establishing it in our bylaws. So I was talking with Amy about it, and really, it's a line item. We went through, we looked in the minutes that said we took this vote, we discussed it, and really what you see on the paper is what we said. We're going to establish a 25 to 35%. I don't know that if anyone wants to finesse it more, but it's just to have an item within the bylaws that says that we do this. So it's a discussion item now for us to have at the next meeting, and I wanted to put it out there in case there is a finesse of language that people would like, so that I can get it to you to review before we vote on it.
What is the current language?
If you would want to change any, the current language is a 25 to 35% fund balance has been established by the county board to be maintained during the calendar year. And we don't have any, you know, that's what I'm saying, we're kind of finessing the language now. I wanted it as a discussion item to see if there are specifics that people want. We don't really have an established line item for it either, so we can work together to craft that. But before doing so, I wanted to make sure I had a full awareness of everything that anyone would want to have included in that.
When you say approved by the county board, you mean us. We've approved this before, and right now it's by vote of resolution.
Correct.
My thought is, if you go so far as to put it in the bylaw, it should be expressed as a goal.
You really want to watch your wording there, because
That's what I'm
certain
saying.
words
It's-
are legally binding.
As a goal, an objective,
May
and with
versus
the
shall.
understanding that you can
As-
always, in the way you adopt it each year, you can always go above or below. But to have it in the bylaw as an objective makes some sense. But I wouldn't put it in as a mandatory. Because then every time we have some circumstance, we're going to be amending the bylaws again, and I don't think we want to do that.
Yeah, if we end up spending all of it one year, we're not gonna be able to refund it the next.
Yeah, so I mean, we need language, and maybe that's what you're saying.
Yeah, that's what I wanted to get ideas.
That's my
and
feeling.
put that together, and that's why I wanted to kind of get everyone's input.
Well, then there's also the issue that he finally did discuss about really not giving us an accurate total budget figure.
Right.
They're
True.
putting out 2.2 million, and we're really at 1.2 million.
So in our objective, it needs to define, if we say 25 to 35% of what? Of what?
Well, it would be our budget. Our budget's very clear. I mean, it's 1.2, where it gets kind of hidden. It was the fact that he wasn't taking out the city department pass-through.
Yeah. So what are we talking about? I mean,
Yeah,
it's
we-
25 to 35%
Of 1.2, and we did discuss, maybe 25 to 35% of 1.2 isn't enough to have, so.
That's what we got.
I mean, we could, if we have a bylaw that says our goal is 25 to 35%, we could pass 40%.
Right,
Yeah.
that's
Yeah.
right.
'Cause it's what's-
Then the 25% would be of our budget, unique to the county, not the city. Yeah, but then,
We shouldn't have to give that language.
what do you mean by that? I
Well,
think I
it
agree.
should be obvious. I mean, we shouldn't have to, we ought to have the city's portion out of our
Yeah.
reports. In the past, we have.
So we want language that would clearly define what the 100% is.
Right, 100%.
and then say objective, that's not set in stone, 25 to 30, or that's the number.
Well, and currently we're saying of the total of the fund balance, and this is where we are also in conversation because that fund balance is a moving target also. And it's continually changing based on if we have, you know, like for example, the paybacks to OSF and Carl and other kinds of things that have to come out of that monies, what we attribute for grants, like what we've done in the past when we've given additional monies for recruitment of dentists to Promise Healthcare, those kinds of things have come out of the fund balance. So that number is also changing. So I don't know if we want to be specific on like a 1.2 or whatever's in there because it may be 1.2 this year and it's 1.3 next year, and you're going to get back and forth with that.
It shouldn't be
so.
a specific number.
Right,
You
that's
should
what I was thinking.
Define it somehow.
Yeah, we used to have, like 25% of budget as of beginning of fiscal year, 2020, whatever, minus any dedicated expenditures that are decided on in the previous year. I mean, you can keep going about however you want to do it, but, and it probably should say something like, you know, may instead of shall, may hold the balance of 25 to 35% of.
Yeah,
What's on us, like right before we all vote on it.
What's important to recognize is that we've been voting 25 to 35% of the wrong total. So, you know, we're considerably higher than we would normally be.
Oh, do you think we should change the number? You said? Should be
Well,
30 to 40.
My basic thought is that we ought to have the county administration giving us the right figure. But is 25 to 35% of 1.2 enough for a major disaster? No.
We learned that.
Yeah.
I would also ask, is this fund just sitting in a bank somewhere, or are we actually, is it possible to invest this fund? Well, it's not doing so, because we do that with,
It's on paper.
like other funds like, the ARPA fund interest, we just reinvest it so that it's actually growing instead
Yeah,
of
well,
just sitting there collecting whatever you're paying.
The county administration is handling all that.
Mhm.
So I suspect that they should be investing it just like any other county.
Do we know?
No, we do not, do we?
That would be something
No.
to find out, and you can put that in the bylaws, that this money should be invested in,
Can-
interest
Can we
rate or
collaborate
whatever.
with
So
the
that if
staff?
a new treasurer comes in, they don't have to,
So our
reinvent the
finance-
wheel. It's in there.
It's in there.
Yeah, our finance director is in Washington DC for a conference. But before she left, she told me that she had reached out to Travis and that Travis was not able to give the exact number.
And that's due to the audit situation.
Yeah.
I don't know that we need the exact number, we need the exact language that would define the number. Can our staff, county staff, help us so that we're all on the same page, where it's apples and apples?
Is that something Mandy can obtain?
It has been done in the past.
Yeah, that's possible.
Yeah.
So I think mine is limited on what she can get as long as Travis is available to work with her. So I don't know what they're going through the county, but it's really difficult for Travis to give out updated information. So we can try.
Well, you're not asking for a number, you're just asking for definition of the
Okay.
number.
So we
How
will-
about you and I email Travis, can we try that?
Okay. Try.
In the case that we need more money, how do we go about it? Is it like the county issue bonds for it? If we, yeah.
If we
I bet-
needed more money, yes, it would be the county having to do it. Yeah, something like that.
And through the
But
bond market.
hopefully we don't get to that point.
Well, yeah, I mean, hopefully, but like.
You know, we probably came close to that point with COVID, but the Fed
Yeah.
stepped in.
Yeah, but if you have a dysfunctional Fed and
Oh, come on now.
like,
It never happens.
right?
Yeah, any bad government overrides any good policy.
Does that give you
Yeah,
enough to?
that helps. I appreciate that. That's why I had it on here, because I wanted to have this conversation, because we kind of talked about the tail end of the meeting, and I didn't feel like we fully, discussed it, and so I didn't really want to come up with any kind of language without everybody's input on that. So thank you, and then we'll get together, we'll try to follow up with Travis and get some more specific language, as well as, get an answer to the question about whether or not the funds are being invested or can be invested, because I don't know if they can be, so I'll find out.
Because we would lose a lot of money if it's just sitting in a bank,
Right.
just from inflation alone, and then not to mention currency risk.
But the question is that it's gotta be in a fund that can be drawn down quickly.
So
That's why, you know, 7-year bond.
Yeah, I don't know for the county, but at least for the CU, public health, we invest the money, we just don't, we put it on the CUs.
And I know there are, like, funds that the state treasurer offers to the municipalities.
Yeah, right.
And I don't know if there's specific language in how the referendum occurs and how the money is, given and all of those kinds of things. I don't want to say
Rocket.
yes or no.
Yeah.
Into someone,
Yeah.
specifically about that. Okay, so we'll follow up on that. Is there anything else on the agenda you wanted to? before I-
No,
Okay.
I mean, that's lots of other votes.
Yep, awesome. So I'm going to take us back to the top of the agenda. Going back to approval of the minutes and approval of the agenda. We were not able, because we didn't have a full quorum, to do that. So C, I would entertain a motion to approve the agenda. I know,
As modified.
as modified,
As
I know
modified.
we'll have to try, but
Second.
thank you. Moved and seconded. Thank you very much. Any discussion? All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. And then our next item is approval of the minutes from the December 2nd meeting. I would entertain a motion to approve the minutes. Moved and seconded here. Thank you, Amy, for doing such an absolutely amazing job with the minutes and keeping on top of everything. I really, really appreciate it. So moved and seconded. Any discussion about the minutes, any changes or corrections?
I thought they were good minutes.
Hearing none. All those in favor?
Aye.
Aye.
Anyone opposed or any abstentions? Thank you. We have no public still, so, but we have called for public participation. And then that takes us to correspondence and communications, and please join me in welcoming Mamadou. I know you've already been here, but it's wonderful to have you here again, and congratulations on your appointment. We look very much forward to continuing to work with you.
Thank you. Yeah, no, I'm very grateful and happy to be part of the group here. And all the staff, they do an incredible job, and I'm just happy to be part of the team. So for correspondence, we were planning to discuss this position and fundings probably in the next round when you guys are proposing funding. But just want to put that in the back of, on the radar for people, that we have hired a food access specialist positions, and we did that because of the need of someone in the community that need to have understanding for all of the services that we provide here in the county, but also be gathering everyone in terms of service provider for to distribute food in the county. So the idea was, that was the idea. So we applied for a grant, secure a grant, I think it's 100,000, but it would only last until July of this year. So we were planning to have other community partners and organizations join in to fund the position to make sure that it can extend to another year. But at least I wanted to share that with you. I know the physical year, the calendar year for this group is different than the physical year, so there is some mismatch there. But just, if you feel like this position will be beneficial for the community and help, allocate some funding for this position, I think that would be brilliant and really needed for the community. So I put it on the correspondence just to share that with you guys.
So one question I have
Yeah.
is, currently we fund a percentage of everyone's salary that works for the county. So would that be what you're thinking of, or are you thinking about this separate from CUPHD employees? That this would be, something like where you would do a grant proposal, like what we've done with funding the sexual health education program or those types of things. So just so we're kind of clearer understanding what your thoughts are on
So
that.
the second one,
Okay.
the second option, so, because the funding this funding, when we post the position, we clearly mentioned in the job description that, once the funding ends, the position will end. But once we hired, so there is a food summit coming up, I think this week, Thursday. So we had, after we secured the grant and hired the person also is from the community and well-known, and, she's planning to do a lot of fundraising. But we just know that it won't be enough. We have a few commitment from other organization, wanted to give, 10,000, 20,000, but none of those are guaranteed, so it's not on the paper. It was just, they will take it to their board for approval. But we know that this is something that's needed, and we saw the benefit during the SNAP cuts, that window when things were uncertain for food security. So a lot of good deed and good people trying to help, but I don't think that would be enough to pay the position if you look at it. So I just thought of bringing to the board here to see if you can allocate some funding, if the budget allowed for the county to do that, that would be great. But just
And I'll turn over, I just have one question. The $100,000, just to be clear,
Mhm.
that's what you mentioned. Is that the totality of the salary plus materials, transportation?
Everything.
That would be everything. So to fund the person for a year and all the things that they would need, their travel and everything, that would be $100 grand.
So 100 grant is the grant we secure from the state to do this, to hire the person. I think they provide the grant as a pilot to just see, and usually they do that for, bigger cities and health department. But it only lasts until, I think, July or August. So we are already in, March, April. So we just know that if there's nothing that we can secure before July, we would probably let the person know, but.
So what I would say is, we just had, for those that joined later, I got an email this week from Francis, Promise Healthcare, and they are wanting to put forth their next proposal for continued funding. We have been giving them over the last 15 years, $50,000 a year for child health funding, for child dental health funding in the community or in the county. And then they have, over a few years, we've provided additional funding for recruitment of dentists in the area. So they're going to be putting forth proposals, and we've asked for those by mid-May. So I would say for this, as well as Whitney's program, to put in a proposal for that and outline what would be needed for the year, thinking about the salary, materials, if you're doing, letting people know, going out and doing, announcements and things like that, whatever would be needed. I'm sure transportation is probably going to be involved, and mileage and things like that. What would be needed and what the request is, like how much is it gonna really take to fund everything that's needed for the position, and what do you need from us, and present that for our June 16th meeting. And if we could have that like about mid-May, that would give us enough time to get it out in the packets for people to read through all the proposals that we would receive before the June 16th meeting. That would be kind of my thought. I'll open it up for other people's questions.
And I'm really happy to answer any question. I asked Amy earlier to take out, this part, like the correspondence part, out of the agenda, because in my mind, you are in the first quarter of the calendar year, and there's no need for me to present it because the budget already. But I'm like, it's already in the agenda. I'll just share what, all the community members are asking us to do. So I think we did our part. We secure a grant, hire the person, so now it's sustainability. How do we sustain the position? So I think the idea is to, I really didn't explain it well, the position, because I was not planning to talk about it, but the idea is for this person to convene all the food, any organization or partners with CUPHG who work in some type of food distribution, food pantries, to convene and be a consortium. So that the community and resident know, which services or which organization provide what. Because we know that there is a lot of organization here in Champaign County that provide some type of food distribution or food pantry, but usually it's very confusing, the hour where people need to get it, or the time, or the requirement, what are the criteria. So this person really would want to build, the goal for this person is to build a document that have all of those, a one-shop document where people can go and look at hour of operations, the time of the day they need to get it, and the criteria. And also usually like host a meeting, a quarterly meeting, just to make sure that all of those services are still operational and what they have. So that's the idea. I think it originated from the community back then, and they asked us to host the position because no other community organization wants to host this person in their organization. So we, when we secure the government, we can post the position and make sure that other organization can come and contribute.
We had that for years, and back to when I was in the nursing department here, and there was a document. It was about 35 pages, and it was broken into categories. And in the food section, we had everything from empty tomb to the shelters to Eastern Illinois Food Bank to everything, and the hours and who was eligible for that. All of those were specified in there. So we've had those documents in the past that clearly outlined everything available, and we went an hour radius all around the county for individuals that were even on the fringes, so that they knew what was available to them. So I mean, those kind of things historically, I know that they're here somewhere. So there might be things to pull from those, as examples or templates of things that have been done before. Now, obviously, a lot of those organizations have changed over, over the years, certainly. And doing that, but it's very worthwhile. And those were actually printed by the News Gazette, so they had to buy into it too, and they were placed all over the community. So obviously, things are now digital. I'm going back to the 90s. But things, I mean, it's very worthwhile. It was very effective back then, I can see.
See you all later.
Thank you.
Thank you.
What other questions? Is
I think that's all for me.
Any other questions for Mamadou about anything else? Correspondence, communications?
Do you understand that with the current financial situation of the audit for the county, that I believe we are on a list of, like a hold for applying for grants? So you may want to keep that in mind when you are thinking about, we'll just reapply for this grant that's going on right now, at least until that's finalized. I know that 24 is almost there, so it will hopefully be temporary. But if you have like any deadlines for like the end of the month or the end of possibly April, keep that in mind that that may affect your eligibility.
Okay.
You can talk to Travis to get any more detail on that. There was at the last board meeting. It was only like 3 weeks ago. It was very short. Yeah.
Okay. Okay, deadline.
So the county's getting an audit?
Oh, it gets audited every year.
Oh, yeah.
But the fact is that because our our standing, like our bond rating, things like that, depend on our audits being done in a timely manner and, you know, passing and meeting repairs, things like that. Because we do not have an audit for 2024 and we are well past the deadline for that. The state and feds have like certain conditions that automatically trigger if you are substantially out of compliance with, you know, financial requirements for applying, or being eligible to apply for
I
things like
see,
grants. So we're kind of on the naughty list right now.
Yeah. Got it.
Thank you, everyone. Moving on to G, underneath Smile Healthy. In your packets from items 4 through 11, we have monthly reports from November to February for Smile Healthy. So I would entertain a motion to do those collectively, if you would like, or we can separate anyone out that you would like to discuss separately.
Move to do it collectively.
Yeah, omnibus. Second that.
This motion. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? The same, entertain for invoices, which are items 5 through 8. Approval for invoices for the Child Dental Access Program. Those from November, December, January, and February.
So moved.
Thank you. Sandy.
You talking about 3 through 7?
Do you have a second?
Second.
Thank you. Moved and seconded. Any discussion?
Yeah, are we talking about just 3 through 7?
Yes, we're talking about 5 through 8.
And did you say that they're gonna apply again for that recruitment thing after we like?
I don't know.
struck it down?
Yeah, they didn't specify. They just wanted to know when they needed to have it to us, and I told them by mid-May, no later than mid-May.
Well, they don't stand a chance if they don't show up.
Correct. Correct.
And we will certainly invite, I know that there is still changeover in administration there. Have you heard, have they hired any of the additional replacements? They've had 2 at Promise Healthcare. Have you
For
heard of them?
dentist?
No, for their administrator position and then their second, I think, deputy administrator position. Those are both.
Oh, the
vacant roles right now.
chief administrator? resigned?
Yeah, I think. I had-
For who, for Promise?
Yeah, so I had heard that both had left recently.
Interesting.
That may not be accurate, but that's
I don't-
right. Because there's an additional party that was emailing last week, not any of those previous individuals.
Because they have a satellite office in here and we meet regularly, I think monthly, so I haven't heard any of that.
Yeah, clinic downstairs.
So we'll follow through, we'll ask for them to come and have a conversation with us, but I know that there have been a lot of changes there, so hopefully they'll have someone that'll be able to attend. So any further discussion on items 5 through 8?
I just want to be sure I understand. 5 through 8, you're approving,
The invoices for Smile Healthy under G, items 5 through 8.
oh, G on the page. I'm sorry, I thought we just did G. Okay.
Yeah, we did G 1 through 4.
Okay.
Do something simpler for each.
Yeah, okay, we're good. I'm back on the page. All right.
Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. So we're under H, CUPHD, we're at 2, update on a health education program. And Whitney is at a conference and not able to join us, but she did provide information to us. Thank you, Amy, for getting that out to everyone today. So the County Sexual Health Education Program is currently reaching schools in Fisher High and Junior High, Juvenile Detention Center, Thomasboro Grade School, the READY program, and the RISE programs, 5th through 7th and the 8th grade. And she's presently reaching out to Ludlow and Prairie View Ogden. In 2026 through January through February, they have served 37 students, and she left a couple of quotes there for us. Anything else that you wanted to add to that?
Yeah.
Good job.
Yeah. So, well, thank Whitney for us. I really appreciate that update. That I'll entertain a motion then, same thing for an omnibus motion for approval of the CUPHD invoices underneath H. They are items 3 through 7. So moved. Thank you.
Second.
Moved and seconded. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? That takes us to our reports, underneath H, items 8 and 9, the reportable disease report and performance management reports. Thank you, I've seen there've been some updates to that from our last
Oh,
conversation.
excellent.
Those look really great.
Oh, the gonorrhea numbers.
We've got questions already.
It seems a little low. Was it getting safer out there than it used to be?
Oh, no.
We used to be in the 240s or something
I
like
think
that.
because of the impact of the sex education that we are doing, but that's just speculations.
You well assumed the role, backing your staff. Any additional questions about those?
Are we seeing any rise in measles yet, or are we dodging
That's a
that?
good question.
Yeah, really good question. No in Champaign yet, cross fingers and knock woods. But we had a first case of measles in Illinois, Chicago, early this year.
Another one that it's not like the tied to the.
O'Hare, I think.
Oh,
Yep,
okay.
that's
Yeah,
one.
that's one.
But really right now, I don't wanna get off topic, but really right now we're worried about avian influenza.
Oh, really?
So,
Oh.
Are we seeing something, or?
no, we're not seeing anything but bird, wild bird and geese and.
Oh, because it's migration season.
Yeah,
I see.
migration season.
I'm sorry, I said number of cases in the last month
Yeah.
across the state already,
Yeah.
as the spring surge starts.
Yeah. I was just gonna say, it's an opportune time to be having this conversation. Students are back from spring break.
Yeah.
So we will likely see some things here and there.
But I just want to reassure also that we updated our measles MOU with the university, making sure that if any students, so they have in-house student approved housing and outside university. So any student that get measles in the university approved housing, the university will, even though we would, we have agreement with a few local businesses, hotels, that will isolate the person and provide food just to make sure that they don't spread the virus. If it's university approved housing, when students live in those housing, the university will pay us, reimburse us for taking care of the student. But if the student live outside of those approved housing, so we will take care of the student. We just make the MOU very clear and just outline role and responsibility for each organizations. So there is an MOU in place, and I just want to reassure that we are working to make sure that if anything comes up, that we are prepared to handle it in terms of measles. Don't want to speak for all of the infectious disease, but for measles we are planning to do that. So we also are convening agencies, animal control, vet student from the university, vet clinic from the university, and Carl to a meeting just to discuss roles and responsibility in terms of massive or out of normal death from geese. Last year we saw a few of those, and it was challenging because animal control didn't know that they needed to take care of those, and we didn't. We were like, all right, we can't go and take, because that's not public health. So we're getting called to take care of geese in the community, but we thought that it was animal control that need to take care of that. So we are just making sure that we have this meeting, have a game plan, and coordinated, intervention if anything happened. So
Do
we're.
you know who's coming from that night? Is it Stephanie Lewis?
Yes.
She's
Yeah.
dropping a lot
Yeah,
of
she gracefully said that she will be here for the meeting, so we just wanna make sure that we have a game plan and know exactly what to do in case we see massive death. And animal control also is on board. So Carol also will be here. So it's this Friday.
In the past, we've had pertussis outbreaks at the university. You're not seeing any of that yet?
No, not that yet.
One thing is actually around that is about TB and
Mhm.
TB rule out. And what are the university's policies on, I think people should be masked if I don't care until you are ruled out.
Mhm.
Like, I don't know if that's actually being followed.
Yeah,
there.
so we're really careful in TB cases. Last year, I think you asked questions when I first came in about the cases of TB on lab reporting system. So the guideline of a TB for the state is clear. So right now, what we are doing, we have allocated fund from CU Public Health where if someone comes and we test them and they are, highly suspicious of TB, we'll send them to get an X-ray just to make sure the diagnosis is clear because you don't want to treat someone who does TB.
Yeah.
So we make sure that we have those in record, and then we'll pay for a hotel room to isolate or an apartment to isolate the patient and treat the patient until they are not symptomatic. And then we give them stipend for food. So that's in place. And we wait until they have 2 symptom negative tests. And then, and so that's the state rule. And then after that, they can get out, but still take their medication until the end of the treatment. So that's the protocol that we are following. But to get to your point, if someone doesn't get tested or have latent TB and we don't know, so that's difficult, but I can assure you that we work very closely with McKinley Health Center.
Yeah.
So the deputy director here, their health director was the deputy director here. So we work really closely with him. So he is, I'm not aware of any of those cases, but we are closely watching because students are very sneaky sometimes. So
They really are,
Yeah.
And
So-
I mean, especially like if you're gonna get ruled out, I think they should be wearing a mask
Yeah.
at the very least.
Yeah.
And I don't know if.
yeah, it's difficult. I think this year it's like 68,000 students that they.
Oh, yeah.
Like,
It's,
yeah, unruled. So a lot of students who follow, but they are very good at notifying us, and the coordination is excellent.
Has there been any meningitis?
Not yet.
Not yet. I don't like those answers, but not yet.
So sometimes, so it's difficult to say we haven't seen it because as we are speaking, something may come up. So I just want to make sure that, so as of right now, as I'm speaking to you, we haven't seen any case. Yeah.
Because there's that outbreak
Yeah,
in
you
London
can.
that was,
Well, plus that are getting it as teenagers now, the vaccination rates have dipped, and so we can anticipate
Mhm.
in the coming years, we'll see more cases
do we
across the country.
have, I remember back in, was it 2010 or 12, we had the mumps outbreak. We all had to get boosted, and it was kind of old-fashioned polio, everybody's lined up in the gym, and they got 6 stations. Is that something you can do with something like TB, or is that not works fast enough to be?
How many TB cases are you currently following?
Good question. So the numbers are last year 15 and this year 2, so 17.
And the ones last year still active?
No, but they still count, right? So
And how are we policing the medication adherence for that?
so we have a really great system, and I wish if you have time you come and follow our disease investigator. So these are folks they're trained on DOT, direct observation therapy. So they really build a good rapport with the patient, and they also install in the patient's cell phone Instacart, where the patient can allocate money on that, and then they'll order food. It's a very good system. So they'll order food on their bed, the food will be delivered at the door, and they'll go get it. So exposure is very minimal. And every day they will go and face-to-face provide the medication every day
Wow.
to make sure that the medication is being taken. And usually in a couple of weeks, most of the things that we have seen is probably like 6 weeks. So after 6 weeks, we retest them. So if they have 2 negative tests, so they become asymptomatic and they can get out of isolation, and we won't pay them, but they can still take their medication until completions, and it's 6 months.
Yeah, that's a long
So-
time.
But we follow them. We follow the system is really good. So if you follow these folks from here, you won't worry about if we know someone has TB and we have them in our record and we follow them, the adherence rate and the success rate of the treatment is very high here.
That's good.
Any other questions?
I guess like in terms of speaking of vaccines,
Yes.
right? And I think this is true, right? Like a court blocked, basically what RFK has been doing with that. So like now it should be okay. People should be.
And we're probably dealing it, it'll go to the Supreme Court.
That's a worry.
Currently, possibly, but.
That was the child immunization. Chief.
Yes, the schedule.
Yeah.
Yeah.
But the schedule has changed, not in Illinois though.
Right,
Right.
just, most of the
Right.
states that cared, just now they're following.
Correct. Yeah. Then like yeah.
That
But-
blue,
but-
I
but-
think, was-
Yeah, but you have to know also that even though we haven't changed, we are still in the country and people travel.
Yes,
Oh, yeah.
Yeah.
Yes.
So
100%.
that's the things that people forget. Oh, we are safe in Illinois. I'm like,
Yeah.
we're not. As long as we cross Indiana to
yeah.
to the zoo and come back, we're still at risk.
Even like polio, like I just find that so wild. I mean, like I maybe seen 1 or 2 patients with post-polio syndrome, like they're like doing okay, but like, is like the collective memory forgotten exactly how terrible that is?
Well, I don't forget it because I'm really old. I was in the clinical trials for the
Wow.
polio vaccine. Now, it was a big issue.
Yeah.
And I know 6 of my contemporaries who had polio and are permanently disabled in some way or other with it.
My great-grandfather had it as a kid, he had to sneak to Ellis Island because they wouldn't let you in if you had like physical issues.
No.
So
okay.
he said his lymph was from a soccer injury.
Soccer injury, yeah, that from Europe. Sure.
Twisted ankle.
Yeah, but I completely agree with you, Dr. Sharma. I just, the people who are having those thoughts, it's wild when you talk to them. It's impressive.
Yeah.
I mean, their argument is just, very impressive.
Polio,
I know.
any parent
Has ever seen
who
it.
doesn't give his or her child the polio vaccine, wow, because they're making, for what reason? I mean, are they gonna turn autistic all of a sudden?
That's the
There's
main
so many.
reason. That's the
So
main
many.
reason. They would argue that they would rather have their kids pass than give them the vaccine. So that's how far they have gone. So.
Yeah, don't even get me started on like how they're treating autism and stuff like
Yeah.
that. That's like
I know.
tomorrow for this
Mhm.
ED board. It's like it's insane. It's terrible.
And it's affecting, if you look at the report for our influenza, COVID, and RSV,
It's affecting everything else,
it's
yeah.
affecting everything.
Yeah.
I mean,
Yeah.
it's affecting everything. Affecting
It's
everything.
spilling over in the veterinary space too,
Right.
so
Okay.
we're seeing more and more orders decline, even things like rabies vaccination.
That is
Oh, really?
insane to me.
Oh no.
They're worried about their dogs
Oh
being
god.
autistic.
Like
Really?
rabies scares
Since
me.
they're not introducing vaccines, so.
Rabies, oh jeez.
That is like-
I think there has been one documented case of a person who survived rabies.
Oh really?
Yeah,
Yeah.
it's a handful, it's like, I think it's
Yeah.
Oh,
like
that's so
17
wild.
now. but
Somebody
the-
in Wisconsin, some
The cure is absolutely.
13-year-old
worse
girl
disease.
survived it.
They basically put her on ECMO for like 6
Oh,
months.
Gianna guys.
And waited for it to
The
move
wall.
through her system because it just basically paralyzed her.
And we had I think it was at the beginning of the year, you asked about, because you have seen prophylactic rabies on the report, and you were asking about that.
Yeah.
And I said it's a good thing because, here people, you know, I think we're very fortunate in this community because of the university and people knowing, especially students, very aware about, okay, if you get,
Big or
you know,
scratch.
yeah, interaction with dog or bat in camping, you need to get, you know, the prophylaxis. So we have seen an uptick on that number. Even at the beginning of the week, we saw someone called.
Well, what it used to be was a horrendous prophylaxis. I mean,
Yeah.
Yeah,
17
injections
shots
into the
in your
stomach
for 30
and
days, yeah.
now it's a shot.
Yeah.
Yeah.
But it's
See,
very.
that should be broadly like
People need to
broadcast,
know.
because
It's
I
such
was
a
under the
very
impression it was still the
preventable
Yeah,
way.
it is.
17,000.
It is.
It is, but it's being overprescribed though too. I mean, if you talk with Dr. Connie Austin or Matt Leslie at the State Public Health Office
Mhm.
too, I mean, they're a big thing, especially for physicians and veterinarians.
Mhm.
We're all very rabies phobic.
Yeah.
And so you jump to doing post-exposure prophylaxis
Mhm.
too quickly, and so the algorithm is very well developed, especially in Illinois where the big risk is bats.
Mhm.
Skunks theoretically, but I mean, really, there's very little risk from domestic animals.
Yeah.
And so I think getting an assessment done should be widely
Mhm.
distributed. People should talk to their physician and get an assessment
Yeah,
done.
yeah.
But actually getting the shots themselves, which are much easier to do now,
Mhm.
should be thought about more carefully because there's a huge cost implication.
Yeah.
That is my point. I always, like, if you see the cost of
Yeah.
that.
Oh,
it's-
I didn't know that.
Yeah.
That's
Yeah, because most people get them done through ERs
And
rather
it's-
than even primary care for the places too. And the rabies immunoglobulin by itself can be, you know, $5,000 to $10,000, and then the
Yeah.
subsequent 4 vaccines.
Yeah,
If
4.
you're doing it in an ER, it can be upwards of $40,000 to $50,000. If you don't have insurance, you're footing that bill, and so it can, especially if it's a whole family that gets exposed,
Yeah.
that can put you in complete financial destitute. So,
Yeah,
so it can be really prohibitive.
that's actually another good point too. Do we know how many people are insured now with like, that they didn't extend it?
Well, Illinois is better than most because Illinois is covering
Yeah.
Okay.
that.
That's the only one.
Oh, okay.
And at least in Champaign County, I can speak about, but in university get, most of the students.
They have to have insurance.
It's part of their student fees, it's better.
Yeah. They have to have insurance,
So
or
now
they have to
that
buy
is a lot.
university
Yeah.
insurance, which is
Yeah.
a very big group plan and
Yeah.
not very expensive.
Yeah,
Yeah.
well,
And they're
they're
under
insured
the
18 to
parents'
24-year-olds, is
bill.
not cheap.
Right, yeah. But in terms of the community, interesting question, and it's very interesting what's happening in the community. Although Illinois is subsidizing the insurance still.
But we just got a report for CUPHD premium, and most of our premium have gone at least 10%
Yeah.
gone up.
Oh, yeah, they have.
Yeah.
County premium's gone up like 20%.
Yeah.
2 years ago, and then it was like 13
Yeah.
last year. And it'll probably go up again, another double-digit increase.
And-
Yeah,
and-
and gas has like increased, what, like 23% since the start of this war?
Yeah.
Like, I don't know, it's like, we're about to face like a huge inflation shock. So.
Yeah, because everything we eat, everything we buy is all
Yeah.
transportation related and
Yep.
it's diesel.
No, it's more than that.
People need to,
MRIs
like-
need helium, which is a byproduct of natural gas production.
Yeah.
That is responsible for 33% of the world's supply, they just shut that down.
We're gonna hit the 70s again.
Yeah.
And I mean, people are not ready for that. So that like brings into the other thing of like investing. I'm like, we need to hedge like.
Well, gold isn't the hedge anymore.
I know, well, it had a good rise, but yeah, I agree, it's an unusual trade right
You
now.
can tell we spent a lot
Oh,
of
pleasant subject.
Yeah.
I feel like we could, was saying or something, I feel like, you know, we could all talk about these things forever, because I feel like, you know, this
Oh,
is a
yeah.
lot of the things we're observing, we're talking about in our own circles, you know, across.
And it's all related, that's the thing,
Yeah,
it's like,
yeah.
We
it's
should have a
all
section,
related.
response to emerging threats. That's what we have for the DD board, and I think that's like, ever since the election, we had this little section where we might put an article, but, you know, or we pass on.
Yeah, we had the crisis center right here when we first started COVID, that whole section that's now, you know, what other groups are over there now,
Extension?
yeah, the extension program and stuff, that was the crisis.
AOC?
Yeah,
Yeah.
so hopefully we don't have to go back to that again, but, at least we're in a community with a lot of people that have a lot of knowledge and expertise, and
That is
you know, we can rely upon that, so we'll call that our silver lining for this evening. Old business, update on the long-term care beds in Champaign County. I know Kathy couldn't be here this evening, but there has been ongoing conversations with Senator Rose and Faraci, and they're continuing to work on this. They have got a $500,000 grant to begin looking at the funding of land to have the greenhouses built. There are multiple departments across the university that are involved: nursing, medicine, engineering, social work, a lot of people going into not only the building out of things, but how we would service these and provide staffing for them, and how they could become teaching centers for students. So a lot of work is being done in the background on things, and now they're looking at getting additional funding to help provide that initial outlay of what it might cost for land. And they're also doing surveys right now to find land in the outskirts of Champaign and Urbana. I think they've been in conversation with some land developers and farmers and other kinds of things, looking at different parcels. So that's as much as I can tell you right
So
now.
is there any talk at all about returning the nursing home to as a nursing home?
No.
I don't believe so.
It's already sold.
Yeah.
Oh, it's already sold.
And they're gonna just tear down all the building property.
Okay.
But they're looking at, you know, this is perhaps the start of something, you know, that could grow. I mean, I think the initial outlay is 100 beds, and then looking beyond that. And there is a company they've been working with out of Arkansas that is making an initial commitment to, you know, running, should certain commitments be made on all those things I talked about before, land and otherwise. And I think at some point they'll be coming to the county for, you know, tax incentives and things like that when they get closer to some of those things. But a lot of people working on it from a lot of different angles, so it sounds like it's continuing to be very promising.
This was like where there was also a semi-independent-ish living where people would come and help cook meals or something like that.
Yeah, so they call them greenhouses, but
They
they
threw me with that. I was like, I thought we were talking
Yeah,
about like long.
yeah,
Yeah, the VA's
they're
got 'em.
called that way, but it's really kind of like a pod, you know, community. So you have communal living spaces, but yet you have your own, you know, bedroom
And I
and
think
bathroom
so many
and
patients
things
would
like
love
that.
that.
Yeah, and you can gather into these collective areas, and they would have, you know, perhaps one nurse working with, you know, several aides or LPNs, you know, in one of those pods to provide, you know, cared services. They're talking about that mix of what is skilled and non-skilled and what we have in the community versus that. So a lot of conversations, because in some of those, you have a pod that is all skilled and a pod that, you know, can be more of an intermediary, you know, kind of that transition process between the two. And so I think some of those things will be more further developed. But the University of Illinois College of Engineering has been working on some adaptations for, in fact, they have a home that's kind of been built on the property over, oh goodness, my streets, I'm terrible with directions. I mean,
Landmark.
I know where I'm at. Thank you. So over where the State Farm Center is, you go off of 6 there and Windsor and back in that area, back in that industrial
The research property.
property, thank you so much. Back in that area, they have put together one of these homes from the inside, and so they have an adaptive room that they've been working on that has lots of different technology that is friendly for those people that might have hearing impairments or visual impairments, people with significant disabilities. And so that technology is easily adapted into one of these greenhouses.
That's amazing.
And so putting that together. And so Dr. Bashir has been involved from the beginning because he's been doing a lot of that work. And so they are part of the core team, so there were about 25 of us representing each of those individual colleges that are kind of, you know, working, you towards is in a lot of different community groups. CPC and many other groups are involved in it.
I'm in the College of Medicine, this is, I mean, they're actually part of the
Yeah.
College of Engineering. I just think about,
Yeah.
like, this is actually perfect onto their mission.
Yeah.
Do you need more? I'm part of that.
Oh, I am sure Kathy will take any name and anyone
Yeah.
who's interested whatsoever, because the more ideas, the better. And I think veterinary's got someone that's involved in there too, because we were talking about pets at the last meeting too.
Oh,
On whether or not,
amazing.
you know.
Pet
what-
therapy?
Yeah, yeah,
Well,
that.
and there are so many older people who don't wanna leave their homes because they have pets and they know they won't be able to.
Yeah.
live in
Right,
places to live in.
So yeah, there's a lot of individuals involved, but yeah, I mean.
Yeah, I'm happy
Kathy's-
to like pass on,
That'd be
because I think
terrific.
that's like, that is the mission, right? They're supposed to be like, oh, we're
Yeah,
engineering.
Carl's
and,
involved.
Let's go and do that.
Yeah.
That is.
You should see about, I don't know how far along it is, but if they could make that modular, those assisted things where you could just like, I don't know if you guys are familiar with modular homes, where it's basically like a kit almost.
Yeah.
You know, the walls are pre-built, you just put them up, as
Small.
opposed to trying to build a lump or whatever.
Yeah.
And that might be something that would actually really be helpful.
Yeah, I mean, it would be wonderful to envision, you know, like, I mean, people talk about those villages in Florida, you know,
Yeah.
where they're all in their little community, they have their own like restaurants and stuff. You know, building something around like that. So if you have more able-bodied individuals who are in independent living, and then you have assisted living, and then you have these greenhouse pods, you know, depending again on space and land and stuff, building that around, and so you have these individuals working with each other.
Yeah.
You know, and
That would
similar,
be
like,
great.
you know, what we've done with Ollie for years, you know, so retired professors have taught programs and things, and, you know, I envision that would be a really beautiful model of doing exactly what you're
That would be
talking about.
amazing. I'm already like thinking, I have like a few people in my mind, I'm like, yeah, because they need to be more social, and they're in this weird intermediate space, like, anyways, but. So, like, idea like that in a village, oh my God, that's like amazing.
Yeah, and of course, we talk about more and more money and more and more lands, but anyway, I
That's a
mean,
good
that would be,
investment, I think.
right, it would, I mean, it would be,
I think if it's built that way, people will pay for it.
Yeah, well,
Yeah,
but I think it's
100%.
really important.
People, like, you have no idea,
I know.
because like, finding a nice place
Yes.
is like the biggest concern. That's what I spend hours like talking
Yeah.
to families about, is like,
Where
and
we're
to the
at.
patients too, they're like,
Yeah.
I don't like this place. I'm like, well, let's try to find something to have some joy with, like, you know, an idea like that, and more kind of even the option of like semi-autonomous, and the idea of pod, it builds community, right?
Yeah,
being active.
we were in that meeting and I was very impressed because I've never thought about nursing home, greenhouse nursing home. So the idea, even it's yeah. And then I was in the meeting when the company from Arkansas was presenting, like the CEO of the company.
Yeah.
They have built this into their community already. This is something that they do. So, but I think it's a great idea.
Yeah.
We were just talking about, at least in public health standpoint, we're talking about, all right, would kitchen, including kitchen in there, in the greenhouse, you know, so that we mitigate, you know, people using the same kitchen and stuff like that. But those, I'm sure all of those can be incorporated later.
So, lots of great things, and Kathy has, you know, again, spearheaded this for the last several years and has a great team, you know, surrounding. So I'm sure the next time that we get together in June, she'll have more to report even.
Is that online? Did they film that?
Yeah, I'll send it to you, Amy, because Open Meetings Act, I can't send things directly to all of you, but I will send, they've got a flyer that they've put together that's talking about this, and it's got some really great pictures and some of that. There's a picture of the land in Arkansas of what they have, and some pictures they've taken there on this flyer. So I'll send that and some of the other additional materials for the group. So I'll send that to everybody. I'll send that to you, Amy, I should say. Thank you very much for doing that. Any other business on the door, Jay? Hearing none, public participation on our non-agenda items, still seeing no public has joined us. Our next meeting is June 16th at 5 o'clock. Still working for everybody?
That's perfect.
Awesome. So I would entertain a motion to adjourn. Gentlemen?
So,
Moved,
very good.
seconded, any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you all so much for your
Thank you.
time, thank you for your dedication. Thank you again, Amy, and congratulations again, Mama dear, we're lucky to have you.
Thank you. Oh, yes.